Top 5 questions about blood pressure. In this video, we'll discuss answers to commonly asked questions about blood pressure. We'll talk about blood pressure problems in teenagers, address how to deal with pulse pressure, and learn how to measure blood pressure correctly and calculate average blood pressure. If you have any other questions, please feel free to ask in the comments of the video. Enjoy watching! What should I do if my upper blood pressure is high and my lower blood pressure is normal? The difference between your systolic or upper blood pressure and your diastolic or lower blood pressure is called your pulse pressure, and this is normally 30 to 50 millimeters of mercury. For example, if your upper blood pressure is 110 millimeters of mercury and your lower blood pressure is 80 millimeters of mercury, your pulse pressure is 30 millimeters of mercury. Pulse pressure increases with age. This may be due to high blood pressure, deposits of fat on the walls of blood vessels, structural changes in blood vessels associated with age, or iron deficiency anemia. Therefore, if a person has an elevated upper blood pressure and a normal lower blood pressure, such as 140/80, it makes sense to examine the cardiovascular system. Treatment of high blood pressure can often result in a lower pulse pressure. If you're concerned about your pulse pressure, talk to your doctor about what you can do to lower it. What is the average blood pressure? How to better understand your health using a blood pressure machine. Blood pressure is variable and can change over the course of a day, an hour, or even a cardiac cycle. That's why it's common practice to measure the mean arterial pressure, which takes into account the flow, resistance, and pressure in your arteries. Now, this allows you to assess how well blood is flowing through your body and whether it's reaching all of your major organs. Doctors generally consider 70 to 100 millimeters of mercury normal. MAP in this range indicates that your arteries have enough constant pressure to deliver blood throughout your body. To calculate your average blood pressure, you can use the formula. Where dP is the diastolic blood pressure, SP is the systolic blood pressure, and PP is the pulse pressure. Now you need to add 1/3 of your pulse pressure to your lower pressure. High BP, greater than 100 millimeters of mercury, indicates high pressure in the arteries, which can lead to blood clots or damage to the heart muscle. Low BP, below 60 millimeters of mercury, indicates that blood is not reaching the major organs. Without blood and nutrients, organ tissue begins to die off, resulting in irreversible damage. You should see a doctor for treatment of these conditions. Why am I getting strange measurements? Mistakes in measurements that have a negative effect on the result. Whether you use an automatic or a mechanical tonometer, there are rules that must be followed in order to receive correct measurements. And we recommend that you do not measure your blood pressure until at least 30 minutes after doing the following: taking a bath, physical activity, eating or drinking caffeine, smoking. Also, please note that alcohol and some medications may affect your blood pressure. Try to avoid alcohol if you want to understand your normal blood pressure. Before you start measuring, sit comfortably at a table. Place your feet on the floor, straighten your back, relax, and breathe calmly. Place the cuff on your arm 1/2 inch above your elbow. Secure the cuff using the Velcro so that it sits flush but doesn't press on your arm. Try not to move. Relax. Breathe deeply, and do not talk during the measurement. It's very important not to measure your blood pressure several times in a row without removing the cuff. The intervals between measurements should be at least 5 minutes. It's important to let the blood vessels return to normal by loosening the cuff or removing it between measurements. We have a video on how to use our automatic and manual blood pressure monitors. Please refer to it in order to achieve accurate results. Hypertension in adolescents. What should teenagers with high blood pressure do? The normal blood pressure for 14 to 18-year-olds is 115/70 plus minus 5 millimeters of mercury. If blood pressure is higher than 130/90, this is a reason to see a doctor. High blood pressure in adolescents is related to the processes of their growth and development, especially with hormonal changes that occur in the body. Hormonal changes are more likely to cause high blood pressure in boys than in girls, a result of higher levels of testosterone. It is very important to see a doctor and to not remain in a state of high blood pressure. During adolescence, there are a lot of diseases that can be accompanied by hypertension. To avoid serious problems, it's very important to maintain a healthy weight, lead an active lifestyle, and to not have psychological tension. Click the link in the corner to be taken to our video where we talk about how to deal with the symptoms of high blood pressure. Hypotension in adolescents. What should adolescents with low blood pressure do? It's important to understand that a reading of 110/70 millimeters of mercury does not indicate a problem in a patient who is 14 to 18 years old if there are no signs of hypotension. Additionally, girls may have lower blood pressure than boys. Low blood pressure in adolescents may be a result of other diseases. In this case, we're talking about secondary hypotension, and it's important to consult a cardiologist or endocrinologist for an examination. If no diseases are detected and blood pressure remains stably low, it is possible the condition may be primary hypotension. This is a functional disorder that the child outgrows over time. Improving quality of life will help elementary measures. These include a well-thought-out regime of rest and work, a proper diet, walks in the fresh air, and moderate sports activities. Follow the link in the corner for our video where we talk about how to deal with the symptoms of low blood pressure. Thanks for watching. We suggest that you watch our other health videos, subscribe to our social networks, or choose a tonometer from our website. All links are in the video description. We wish you good health. Take care of yourself.